As all of you know, ADD and ADHD are very common in people our age. But how common is it really? And where is the line drawn between being enthusiastic and energetic and actually having an attention deficit disorder? Well, some of the biggest telltales of having ADD or ADHD is having an excessive inability to focus on one particular thing at a time. For example, someone with ADD would go back and forth between different things and leaving both of them incomplete, whereas someone without it would do one thing at a time, even if they were procrastinating. Symptoms of ADD and ADHD are very similar, and both involve acting on impulse, lacking focus, being inattentive, and being disorganized. Now, I know what you're all thinking. Well, I procrastinate, and I'm pretty disorganized. Does that mean that I have ADD and ADHD too? This is where our ethical question comes into play. People who may not have actually been diagnosed with ADD or ADHD and still feel like they can't focus will often find ways to get themselves the different medication for ADD and ADHD so that they are able to use the enhancements from the drug to focus on their own work. In reality, according to the American Psychiatric Association, only 5% of people actually have ADD or ADHD. Although ADD and ADHD are both disorders, the world of science has gotten pretty good at accommodating those with ADD into everyday life. Two of the biggest contributors to that are medication and extra time in school. Both of these resources are crucial for someone with ADD or ADHD, but also can be easily abused by someone without it. The process of qualifying for extra time varies between schools, but no matter the process, it's still very flawed. In some schools, all it takes is a doctor's note, and on every assessment they take in school, they're given extra time. In some of the more strict schools, however, you need to go to an outsider corporation to be judged and see how much extra time you would need. This evaluation consists of questions that would reflect one's organization and focus, so it's still easily thrown. Students could purposely act more disorganized or less focused during this evaluation so that they can earn themselves extra time in school. Another resource of having ADD or ADHD is the medication given to them. This medication requires a legitimate prescription, but can still be taken advantage of by those without the disorder. Students easily could request some of the meds from a friend who actually has and needs this medication and take it for themselves. By taking these medications, people are able to increase their own productivity because the medication is designed to help those who have ADD or ADHD focus on one thing at a time. By taking the medication without having the disorder, it increases one's focus even more, and therefore people are able to be more productive in work or school. This presents the question of whether or not people with ADD and ADHD should be allowed to have extra time, and whether or not the distribution of the meds should be regulated more or given out more leniently.
Treating ADHD using medication suppresses symptoms such as loss of concentration, forgetfulness, hyperactivity, and the inability to finish tasks. There are various treatment approaches to children and adults, and people with ADHD do not all take the same medications. There are several drugs to treat ADHD. Stimulants are the most common treatment for ADHD, and they are also known as central nervous system stimulant medications. CNS stimulant medications function by increasing the amount of dopamine and norepinephrine in the brain, which helps one maintain focus and stay awake. Some of these stimulants include amphetamines like Adderall, methamphetamines, and methylphenidates. All of these medications have similar functions. There are roughly 3,600,000 children from ages 13 to 17 who take ADHD stimulants, though some parents do not agree with giving their children medication because they do not like the effects it can have on their children. When doctors diagnose children with ADHD, they tell their parents that their child has a mental disorder and they need to be on psychiatric medication. Occasionally, parents have a strong reaction to this news and do not want to have their children on medication because they do not want their children to be negatively affected by it. Some of the effects of these medications can be depression or severe change in behavior. The abuse of these prescription CNS stimulants for ADHD treatment has been growing, especially in schools. Students have found that using these stimulants can increase their focus and productivity to complete more schoolwork. Most students have easy access to ADHD medications because of friends or family members who have prescriptions for the medications. There is no proof that the use of these stimulants improves school performance and grades. Misusing these medications is actually rather dangerous. Stimulants can increased blood pressure, heart rate, and body temperature. Taking the stimulants at high doses can even cause a stroke. Repeated misuse of the stimulants can cause feelings of extreme anger, suspicion, and distrust. Abusing these stimulants for an extended period of time can cause withdrawal symptoms such as extreme tiredness, depression, and insomnia. Using ADHD stimulants when you do not actually have ADHD gives an advantage over the people with ADHD who use the stimulants to suppress their own symptoms. Most people do not see the problem in giving oneself a boost of productivity, but you need to consider people who do have ADHD. People who have ADHD use these stimulants to suppress their own symptoms, which only levels the playing field between people without and with ADHD. Therefore, by abusing ADHD stimulants when you do not have any symptoms can be seen as unethical because it is a way for those without ADHD to achieve another unfair advantage over those who actually have it.
Although ADHD can harm and disturb oneself, lots of people in high school taking large exams and standardized testing have gotten a doctor's note, which allows them to take either the medication that Lance just previously talked about, and or more importantly, have extra time on these tests. A number of these people do not actually qualify for this prescription and should not be allowed access to the resources that people with ADHD have. This is not only unfair to those who do not have extra time, but also unfair to those who actually require extra time and do not have it. The people that are being unethical do not have any disorder, so the medication and the extra resources only improve them from a superior state of health to an even better state and gives them an unfair advantage. For those who actually have ADHD, these medications and resources only bring them from a disadvantage to a fair state. For some schools, this process can be rigorous, but for others, it's quite simple. Just bring a doctor's note to school and you have the extra time. If you receive that note from your doctor, then on all of your assessments, depending on the school's policy, you're allowed anywhere from an additional half hour to 2 hours on said assessment. I'm sure this has now answered your question as to why I would want to have ADHD or the resources that come with it. For example, a person with extra time or some sort of attention deficit disorder is allowed up to 6 hours on the ACT, a standardized test that is based off speed and knowledge. Now this just cheats the whole system because for each section you're only given a certain amount of time. When someone with an extra time privilege takes the ACT, then the purpose of the exam is basically avoided, and in my opinion, extremely unethical. It's not only unethical for the person who does not have ADHD to receive that doctor's note, but it's also unethical for the doctor to write that note, even if that person is not strictly diagnosed with ADHD. Now, they do this for numerous reasons, for more patients, for more money, etc., and that's clearly unethical. A professor at the University of California, San Francisco said, "I also believe that ADHD is significantly overdiagnosed, and for those who do have the condition, medications aren't always the best or only option." Sanford Newmark says he agrees that these medications should not be overdiagnosed and the medication might not be the only treatment option. He also said there are no rigorous studies that prove ADHD medications work over the long term. The real ethical question to be answered is that if this is not harming anyone but just helping someone, how can it be conceived as unethical? Well, this is unethical because it gives an unfair advantage to those who are not in need of the special medication and treatment and only places those who are eligible for the medication and extra time at another deficit and only creates the same environment they were in before.